I think the main promises of the mental health reform process are to really focus on evidence-based, coordinated, cross-sectorial approaches to meet the needs of the mental health and drug and alcohol consumers within the Murrumbidgee communities and more broadly within New South Wales. There's a range of priorities that are outlined in the plan that certainly tap into what we're doing within the Murrumbidgee. Trying to improve access to services is a key priority area, and that's certainly something that we've identified as requiring improvement within our service. I think providing equitable services is also highlighted in the Living Well document, and that's something that we've really noticed and that presents a challenge for Murrumbidgee. There's an emphasis on early intervention and prevention and promotion in the Living Plan. Certainly we need to continue to deliver early intervention services, but I think community development is something that other services can probably do and do more effectively than what we're able to do at the moment. One of the challenges that Murrumbidgee faces is geographical distance. It's a struggle for our mental health and drug and alcohol clinicians to visit some of the consumers in the more remote sites at the same frequency that they would visit consumers in sites that are located closer to their teams. I think one of the ways in which we're attempting to reduce reliance on fly-in and fly-out services is by looking at expanded nursing roles, including nurse practitioners. It's cost-effective, but also likely to bring a range of benefits to our consumers. We've also begun to recruit peer support workers, and they're playing such a crucial role in changing the culture of our services and really instilling in other professionals the need to become more recovery-oriented in our approach to service provision. I think in order to support some of the changes in the Living Well document and be ready for reform, resources is one of the huge things that presents a challenge for the service. Many of our specialist services only consist of 1 or 2 clinicians and who are already stretched in terms of their current work demand. So if we are to lead the reform process, or at least contribute to it, then we need additional assistance or resources to help us in that process. The mental health and drug and alcohol clinicians need a range of skills. They're already quite well equipped to provide acute and crisis intervention services, but certainly would need to build on their ability to provide therapeutic services to consumers. That's quite variable depending upon which team you're accessing at the moment, what discipline the person who is case managing you or providing care for you happens to be. And certainly in terms of interacting with other services, there's also that level of variability. So in order to be prepared for the reform process, I think we really need to be clear about the skill base of our clinicians, what they can and can't provide, and the skill base of the clinicians of other community managed organisations and primary health networks. Over the next 10 years, I'd really like the Murrumbidgee mental health and drug and alcohol services to be integrated with other key service providers, to have a shared or integrated IT system where we can readily access each other's information, where consumers are not required to duplicate their stories, where we're much more consumer focused or oriented, with the consumer based at the centre of services, purchasing those services that are best suited to their needs.